can the Prime Minister tell Canadians if he's expecting a reduced or zero shipment from Moderna on the week of February 22nd?
It was going to be a massive challenge for companies around the world to develop and produce a vaccine that didn't exist yet when we were signing these contracts last summer. That's why we signed so many different contracts for so many potential doses for Canadians to ensure that we would be able to
it's just
Canadians
$250 million. I mean, what's that between friends, right? Anyone?
To order. So welcome everyone to meeting number 19 of the House of Commons Standing Committee on Health.
Thank you, Chair.
The committee is meeting today to study the emergency situation facing Canadians in light of the second wave of the COVID-19 pandemic. So I would like to welcome the witnesses. From the National Advisory Committee on Immunization, we have Dr. Caroline Quoctan, Chair and Professor, Université de Montréal. From the Public Health Agency of Canada, we have Stephen Bent, Director General, Kimberly Elmsley, Senior Vice President, Bursabel Ephraim, Director General, Center for Communicable Disease and Infection Control, Cindy Evans, Vice President, Emergency Management, Dr. Guillaume Poliquin, Acting Scientific Director General, Dr. Roman Chomsky, Senior Vice President, COVID Vaccine and Therapeutic Acquisitions. I've just summarized that the above witnesses are asked to present on the following: A, current outbreaks, occurrences, and modeling for COVID-19 variant spread in Canada as it relates to projected vaccination rollout timelines. B, capacity to surveil the emergency prevalence and spread of variants. C, current federal government assumptions regarding vaccine effectiveness on variants in the context of the federal government's vaccine portfolio. And D, Canada's procurement of variant-related booster shots. And so we will start the fourth round again with the Conservatives. I don't have who's on the list for the Conservatives. Ms. Rempel Garner, would you advise, please?
Sure, I guess I'll just go for it, Chair. I guess today I'm fairly concerned about the data that is being used to inform decisions that are costing trillions of dollars to the Canadian economy, lives, and mental health. I find it extremely shocking that, and I understand that people are trying to do their best, but I find it shocking that people came to this, that these levels within the bureaucracy came to this meeting without being able to provide basic information on modeling that was released as early as this morning. So I'm just wondering if perhaps somebody in PHAC from one of these departments can explain to me how some decisions are being made. So let's start with travel measures. How did the quarantine hotel, I'm just wondering how did this decision come to be? Like how did this come into place? Was it PHAC advising the minister, or where did that discussion start?
Mr. Chair, thank you for the question. When we look to the border measures, important conversations that we have occur at our special advisory committee, where we have discussions with our chief public health officer, as well as with the chief medical officers of health for all of the provinces. An important aspect of that conversation has been the concerns with respect to importation of cases in Canada. Similarly, we look to other, Mr. Chair, if I may finish my answer. Similarly, we look to other jurisdictions who are experiencing issues with the variants to see what measures they may have employed with success. And UK certainly figured in the look that we had to other models. Thank you, Mr. Chair.
So what data was used to inform that decision? Specifically, did the UK provide evidence that measures that they had put in place stop the spread of variants?
Thank you for the question, Mr. Chair. I'll start off, and then I may turn to a colleague with respect to what we're seeing in terms of the rates of positivity of imported cases. So certainly we would look at for the travelers coming in and the rates of of positivity that we're seeing from those travelers, including where we may have associations with variants of concerns, and that will impact on the public health measures that we put in place, and also what we learn and know about the timeline of
just because I have limited time,
spread.
This isn't quite where I wanted to go. I'm just wondering what data showed that quarantining in a quarantine hotel would have a better public health outcome than quarantining at somebody's house.
Thank you for the question, Mr. Chair. As I've mentioned, one of the things that's important is taking a multi-layered approach in our public health measures and having effective quarantine measures, particularly at the front end where the infectious period is developing, is an important aspect of that.
What data was used to inform that comment or that talking point? And specifically that quarantining at a hotel was better than quarantining at somebody's house?
Thank you for the question, Mr. Chair. As I've said, one of the key pieces of evidence for the Public Health Agency was with respect to the development or our understanding of the rates of the variants that were happening, how we are aware of the rates of positivity of travelers that are coming into Canada. Mm-hmm. Our conversations with our Chief Medical Officers of Health with respect to adherence to quarantine measures and how we could put more robust measures in place to assist in reducing community spread as a result from linkage to travel.
Could you table with committee next week the data that you used that showed that quarantining at hotels would be more effective than quarantining at somebody's house? Would you do that next week? Does that data exist?
Ms. Rempel, I don't believe that was the witness's testimony.
I'm just asking, no, Chair. So to the witness, through you, Chair, could they please table with committee the data that they used that showed that quarantining at a hotel was more effective than quarantining at somebody's house?
So once again, I don't think the witness asserted that.
But I'm asking that question. Can anybody at PHAC table data that shows that quarantining at a hotel is better from a public health perspective than quarantining at somebody's house?
So, Mr. Chair, thank you for the question. What we can bring forward is certainly happy to take that question back to the department and look for.
Can you table that with committee through you, Chair?
Just for clarity, Mr. Chair, and just to bring forward the rationale in support of this.
Could you table with committee the data on adherence to quarantine for the last year? Does that data exist?
Mr. Chair, we'd be happy to take that question back to the department and bring forward information with respect to adherence to quarantine measures that's available. Thank you.
Was that data used in informing the decision to make people quarantine at a quarantine hotel, which I note in the main estimates is going to cost $250 million? So what data was used to inform that decision? $250 million. What data was used? Anyone? I mean, it's just $250 million. I mean, what's that between friends, right? Anyone? Any data? No?
Thank you, Ms. Rempel Garner.
Thank you, Chair.
Going now back to the Conservatives. Ms. Rempel Garner, is it you again?
Mr. Barlow.
Mr. Barlow, please go ahead, 5 minutes.
Thank you very much, Mr. Chair. And maybe somebody from PHAC, what is the percentage number of Canadians who have to be vaccinated before we have no longer have lockdowns and travel restrictions and quarantine restrictions are lifted?
Mr. Chair, that is, I'll begin, and Ms. Hemsley may have additional comment. On the issue of the necessary level of protection, that is a dynamic question. As we continue to learn more about the effect of variants of concern on long-term efficacy of the vaccine. We also need to understand the duration of immunity in the population, as well as the effect on transmission. So it is a complex number that is potentially going to change over time as the state of the science evolves.
You know, I hope the representatives from PHAC here today understand how devastating these lockdowns are to Canadians, not only for businesses, but for Canadians' financial and mental health, which is being profoundly impacted. And the concerns that we're hearing is, just from today, is no data is being provided to warrant these lockdowns. So why isn't this information available that can warrant, that I can go and tell my constituents that the reason that you're being asked to lock down further is because of A, B, and C? Why isn't that information available?
Mr. Chair, on the issue of the changes in the outbreak dynamics and the impact of public health measures, as has been mentioned previously, there was modeling released today, which shows a number of different scenarios, including the maintenance of current public health measures. And the
Mr. Maybe I can put it this way. Sorry, I hate to interrupt, but maybe I can put it this way. When will you know? When will you have this? When can you put a timeline, and when you'll have the data sufficient to understand how many Canadians would need to be vaccinated before we have what would be acceptable herd immunity and no longer reasons for lockdown? When would you have that data available?
So that is, Mr. Chair, that is a question that is a moving question, or a moving point, as we learn more about the interplay of this virus. We continue to learn more on a daily basis about transmission dynamics. And now we have the additional layer of complexity introduced by variants of concern, which have different properties and different impacts on transmission. So these are live questions that continue to be updated and explored as we learn more.
Okay, thank you. So what I'm hearing is you have the data available, which I actually haven't heard that today, but PHAC and the Government of Canada, the Liberal government, apparently has the data to enforce border lockdowns and travel restrictions and quarantine people in hotels. You have that data, but you don't have the data available that we can tell Canadians when life can go back to normal, Canadian businesses can reopen, and Canadians can go back to work. We don't have that data. Is that what you're saying?
So, Mr. Chair, on this issue, data is not a fixed concept. We continue to learn more and to learn about this and add to our understanding of the transmission dynamics. The modeling that was released today demonstrates a number of different scenarios, including one where variants of concern with a 50% transmissibility increase are in play in Canada. And we see from that data that public health measures are a necessary component of achieving outbreak control here in Canada.
And I appreciate that, but this is having a very real impact on Canadians, and they need some answers. So the last question I want to try and get out to Mr. Chair, if I have some time here, is we've heard today some very different perspectives that I think we've heard is if we have the most robust access to vaccines in the world, which we keep hearing, even though we don't actually have vaccines in hand, we keep hearing that we have access to them, then why are we now rationing those vaccines? And we've heard today that we may be extending the time between the first and second dose, or maybe even we won't even need that second dose at all. Why such a change in the information that we've heard from the beginning of or the last few weeks to what we're hearing today? Why that massive change in, if we have all these vaccines, why we are rationing and then maybe having, instead of 2 doses, only 1?
This is a matter of the evolution of the science. It's really as simple as that. We're learning more about the effectiveness of vaccines. We're learning more about the efficacy of 1 dose or 2 doses. This is all quite expected in the context of watching the population in its response to vaccines, and watching vaccines as they interact with our population. And so, to be quite clear, it is us as a globe learning about, through the science, how to use vaccines most effectively. And that's what this conversation is about. And so when Moderna and Pfizer were authorized for use in Canada, they were authorized according to the clinical trial data that the companies brought to the regulator. Once the vaccine is in use in a population, as with all vaccines, then you look at effectiveness in the real world, and you start to understand whether or not the way that the vaccine is being delivered in a population can be revised, and whether or not those adaptations that you might make are having significant public health benefit. If they are, then you can modify your use. If you see that things are moving in the wrong direction, again, you modify your use. But it is squarely the evolution of science.
Thank you, Mr. Barlow. We go now
to... The Prime Minister thought, who should I buy them from? He looked around the world and he said, I know, the country that's holding our people hostage. You can imagine the PRC Politburo filled with bureaucrats rolling around on the ground in gut-splitting laughter at this Prime Minister's naivete. Madam Speaker, simple question. When he wasted 100 days in the PRC, what the hell was he thinking?
Anyone? I mean, it's just $250 million. I mean, what's that between friends, right? Anyone? Any data? No?
Thank you, Ms. Rempel Garner.
Thank you, Chair.